Welcome to Visions for Health. I'm Dr. Wendie Trubow, and my guest today is Dr. Rajka Milanovic. She is a family physician, board certified. Thank you so much for being here today.
Thanks for having me, Dr. Trubow.
Welcome. Call me Wendy.
Okay, Wendy.
So tell me where you did your medical training, your residency.
Sure. I did medical school at the Ohio State University College of Medicine. That's in Columbus, Ohio. It's a Big Ten school. I interviewed all across the U.S. for family practice residencies and stayed put in Columbus, Ohio. It is a medical institute called the Grant Medical Center.
After all that, right?
After all of that, yeah, I ended up in Ohio, and then the first chance I could go west, I went west initially. So,
very nice.
Yeah.
So today we were going to talk about big picture things, right? Like the 5 core areas of health approach.
Yeah.
How that matters for people, and then what do people do in their daily lives.
Sure.
So when you're with your patients and they sort of plonk down in the chair and they say, fix me, what happens? What are you looking at?
Well, you know, the first portion is to take a nice intake. What makes them a person? So from what do they eat? How do they sleep? What is their social life like? Where do they work? Does work make them happy? Where are their stressors in work? Where are their support systems? And I'm looking for any tip-off of where the imbalances may be in their life, from the sleep, the physical, and to the psychosocial with who they interact with, and the spiritual, what's their purpose in life? So we're looking at all of that, whether the patient's aware of it or not. I'm on the lookout for it.
I mean, have you found that someone without a purpose in life, it matters?
It does, and it's real subtle. They may not be aware of it, but you know, the majority of patients that come in and that they've said, I've been to so many doctors, I have all these symptoms, those are the ones that make me worry. You know, maybe that this underlying, I haven't developed or I haven't found what my purpose is, or there's no driving force, and that's where I'll choose to explore as soon as they let me first.
Right.
Yeah.
Do you have any examples of anyone who had any of the 5 imbalances, either in their structure, their chemistry, emotional, energetic, or spiritual?
Sure, probably every person that I can think of. So from a very simplistic viewpoint, you know, we tend to see the very healthy or the very sick. So I always say you can come in at any time frame, and we're happy to help. It's certainly
anywhere on that spectrum.
Anywhere in that spectrum, but that's what it seems to be. So I really love when I can get someone in their 20s and they feel relatively healthy. We look at all those systems and you identify minor imbalances. So maybe it's with their diet and the vitamin levels in their body, and you fix all the imbalances. And on follow-up, I love hearing, wow, I thought I felt great before, but I feel even better. And that's my tip-off where I say, well, look, life is going to sometimes have its ups and downs, and the better prepared you are biochemically, spiritually, emotionally, the better you're going to weather those ups and downs from a health perspective.
How do you talk to people about making a change? Because, you know, you say to someone your favorite food is going away, and I would imagine that they're going to run screaming from the room like, it was nice to meet you, doc. Yeah. I'm out of here.
Yeah, that's a good question. So part of my job is to assess what kind of personality. So you've got people who can cold turkey. I always say they can stop things cold, and people who need that gradual kind of decreasing of whatever they might be eating that's not good for them. So I always approach it from like, look, this is not a sprint, it's a marathon. So it's step by step. For some people that means they eliminate whatever food they might be eating that they shouldn't be eating right overnight, and the others, we say change can take up to 21 days. So take it as a process and think about, where do they get hung up? Are they eating that fat-filled snack with bad fats at night, at bedtime? Is it because they're bored? Are they stressed? What's driving that? So we look at, and then what can we replace that with? So I give them options. I let them know that they need to be prepared to make the change and then do it. And then I can troubleshoot when they come in. They say, look, I got hung up here, and I can assess how else can we approach this.
So you're seeing people multiple times. It's not like see you next year.
Yeah, exactly. So that's the difference, and the beauty of being able to see patients on an ongoing basis till I say, now you've graduated. So sometimes you can get them to where they're, and that's the goal, is to get them where they're seen yearly or a couple times a year. But until they're in balance, it's a few times. It's the initial visit and a longer follow-up. And
So you are a family physician. That means you see people of all ages?
I do.
And are people at all ages interested in feeling better? I mean, seems sort of self-evident.
Yeah, they are. You'd be surprised. Sometimes they don't realize it until you make the changes, and then they're motivated by a change that's made them feel better, and then they get interested in more and more. But
do you work with teenagers?
I do. It's a very interesting population. It's great to work with them. You never know their take on you, but it's really finding that commonality. So and I do that a lot in the initial conversation. What drives them? Where are their likes? Where are their dislikes? And putting it into their terms. So instead of some doctors saying, look, you need to get up and exercise, and saying, wow, you like soccer? Well, you're playing on one league. Maybe it's time that you practice at home so you can get better while you're playing in that league, or maybe you can pick up a second league. So putting it in their terms.
Have you had any teenagers for whom you've been able to make a difference?
I have, so that's very interesting. So a lot of them come in, and it's usually driven by the parent, right? The parent says,
they haul them in.
Yeah, they haul them in, and usually I always give the adolescent who's in the chance to talk about why they're there. Usually say, my mom brought me, or whatever. And then eventually, as they warm up and you come down to their level and you're chatting in their terms and creating that bond and that relationship, they can say, yeah, it really bothers me. I had an adolescent that had a fairly significant eczema, and he said, well, what can I do? And as he got to trust me, we identified some triggers for him, eliminated the triggers, had him moisturize his skin, and then we replaced some of the vitamins he was deficient in, and I recommended that he be on fish oil. And it was amazing when I saw the mom later, it was at her appointment for follow-up. She says, he says, I have to take my fish oil so my dry skin stays away. So that was clearly motivating for him.
So something as simple as fish oil.
Something as simple as fish oil.
Helped his rash, basically.
That's right. And for the people who don't know, eczema is just dry, itchy skin.
Okay.
Yeah.
So talk to me about what you think the most important improvement is that people make in their health, in their care of self, I guess.
Care of self. Well, the obvious would be the diet and exercise, but the one that I would like to push is really the mind-body. I think too little in today's age and stressful times and busy times. Think about your day-to-day activities for any family. It's always work, followed by activities for the kids, followed by a flurried dinner and homework and bath and bed. That's very rushed. So I try to bring it down to the basics. When are you taking time to be mindful and focused? So it's sometimes a challenge, but to get a patient to sit down and do relaxation breathing or meditation for a very short period of time, but something as little as 15 minutes a day, most days a week. So even less than exercise really can optimize how someone feels.
Why, though?
Why? So when we're stressed, a hormone in the body goes high, and that's cortisol. So it's called upon by the body to be able to deal with that stress level. When cortisol goes high, it can lead to many ill health effects, one of which is that it raises your insulin, and raising your insulin raises your blood sugar. So think about diabetes, so high blood sugar. So that's just one, but there's multiple. It's a cascade effect, and I always call it a vicious circle. So by meditating, you can bring down that cortisol so that you don't end up having early diabetes or high blood sugars.
So can we drill down into this?
Yeah, sure.
So you have a stressor,
Yes.
whatever that is, something you interpret as stressful. Your body then secretes cortisol.
Yes.
And cortisol causes your body to do all kinds of funky things. One of which is raises your insulin, but can make you resistant to insulin?
Yes. So, yeah.
So then when you're resistant to insulin, it's harder to get your blood sugar in normal range.
That's right.
You're more likely to gain weight.
More likely to gain weight.
And not good weight, nasty weight, right? Like
weight that distributes your right.
I call this nasty.
Yeah, nasty weight. So right in your abdomen, right where nobody wants to gain weight.
Right.
So.
And I've also read that it can impair your memory long term. that high cortisol can mess with like, how you think and your memory. Okay, so far it's not good. And you're saying that by meditating. Now, when you say meditation, what do you mean?
So that's being really focused on the breath and trying to drown out all the signals that come into us. So a lot easier said than done. And I always tell my patients, getting to that hover-like state where it's almost pre-sleep. So especially with the relaxation breathing. And initially, if someone starts to meditate, their mind is going to wander. And that's natural. I say it's going to wander, and I don't mind, or you shouldn't be concerned if it wanders the whole time you're doing it. So it's oftentimes easier to do guided. So that means a little voice, not in your head, but there's many smartphone applications where you can download to your smartphone and listen through a little headset, so you remain focused. And as you get better, you can meditate without any guidance.
And is there a way of breathing that matters?
Yeah, there's a simple technique. So really you're focused on the breath, but I will tell patients to use the 4-2-7 technique. Would you like to hear about that?
Yes.
So the 4-2-7 is a nice way, say you're in the middle of the day, you can't pop in your earbuds and listen to your meditation app, is that you inhale for 4 long
I'm going to do this
breaths.
while we talk. Okay.
So, and I'll talk you through it. So
Okay.
you inhale for 4, 2, 3, 4, and you hold your breath for 1, 2, and you're going to exhale for 7. 1, 2, 3, 4, 5, 6, 7. And then you would simply repeat till you got to a level of feeling calm. And I'm not certain why that ratio works, but it does. So it was taught to me, and then now I teach my patients. And I had a patient that came in the other day, and she was very stressed. She wanted to take on this job, and she had some disabilities, and another doctor that was co-managing felt that it wasn't time for her to take on that job, and it led to financial concerns, and she wasn't able to care for her dog. I mean, this is a long list of
Again,
things.
the vicious circle.
The vicious circle. And I said, wow, you just seem really like in a bad place. So I had her do that. And she thanked me. She said, I feel better just by that simple thing. I said, now remember it. So I even wrote it down in her plan of care. And it's something you can use even when you're not in my office.
I mean, it sounds like it's free.
It is. It's free. It's the best kind of medicine.
Yes.
With no side effects. Yeah.
So when you're doing that, you're quieting cortisol, and I'm imagining you're activating parasympathetic.
Yeah, so you're calming, everything calming, so
Okay.
decreasing your heart rate, so yeah.
Digestion.
So, yep, allowing digestion to occur, so when your stress is high, you digest less well, so.
So does high stress have any correlation to why people complain so often of having a stomach ache or feeling bloated or being constipated? Is there anything here?
Indirectly, yeah. I mean, and then particularly the younger they are. So you think about your children or your adolescents that are high stress from school. I think there's a lot put upon children these days. So.
Okay, so you're saying that simply by sitting quietly, you said you can slow your heart rate.
Yeah.
I'm imagining lower your blood pressure.
Absolutely.
Improve your digestion. It sounds like you would improve your general well-being.
Absolutely.
By sitting quietly for 15 minutes a day and breathing 4-2-7.
4-2-7, yeah.
That's free.
Absolutely free.
And is there any magic to you have to do it at a certain time of day, or you have to, anything like that?
Not really. There was some suggestion that it's energizing to do meditation. So I always say I like my patients to get this in. So I don't mind the time of day. And for some people that are really revved up for the day, it's in preparation for sleep. But if you find it's energizing, then it's a good way then to start the day so that you're refreshed and balanced before you start your day. But for others, it's better at night.
So was that woman able to go get that job? Like, did she get permission, essentially?
I haven't seen, it's been too soon since I've seen her, but yeah. So I think it did help with her ability to cope with all that life was handing her at this current moment.
So meditation sort of impacts the emotional balance, I would say.
Yeah.
And the energetic balance.
Yeah. Which then affects the physical.
The other.
The physical.
Interesting. Okay, so tell me more. Tell me about when you mentioned something about nutrient imbalances.
Yeah.
Are there sort of like the top ones that you go, oh my God, I see this all the time?
certainly. So I think pretty much across the board, unless someone is taking vitamin D, they're either low, which we call insufficient, or deficient, so completely low. And that's, where we're living, sun exposure, some patients that are fairer skinned and don't get out, or patients that are darker skinned puts them at risk. But then just in foods, there's other vitamins that are lacking either by what they're eating, so not enough, what we call the rainbow of foods. So you want to eat your brightly colored fruits and vegetables, or just by virtue of that our soil is deficient in these nutrients as well. So you're getting less of it, even if you're eating these healthy foods.
So even by eating the healthy rainbow colors, perhaps what you're eating now has fewer nutrients than what you were eating 50, 60 years ago.
Absolutely, absolutely.
So so you mentioned vitamin D.
Okay.
Any other, like the Bs, the mags?
Yeah. So B12 comes up a lot, and it's not only in our vegetarians. So in vegetarians have to be real careful because B12 is predominantly from meat sources. Okay. So it seems to be all across the board. And then to add to this, and not to get onto a whole nother topic, but there are some patients that cannot metabolize their Bs. They cannot activate them. So it takes that B from your food and puts it in a form that actually is active and beneficial in the body. Okay. In that those patients with those gene defects, you either see really low levels or very high, and by very high, they're non-functioning Bs, so to speak, in the body.
So instead of B12, they're B non-functioning?
Yeah, B non-functioning, that's a good way to put it, yeah. So.
Okay, and are there people who have trouble absorbing their nutrients also?
There are. So, we look at a lot of what we do focuses on how good our GI, our gut works. So down to the gut. So we like to focus on that. So patients who have an imbalance of the good and bad bacteria, so easily seen these days because one course of antibiotics can throw you off. So they may.
Wait a minute, one?
One course, yeah.
I don't think I know anyone who has not received multiple, meaning everyone I know has received multiple.
Absolutely, as have I, and have you?
Yeah.
Yeah.
Well, I mean, you and I are the antibiotic children, I think.
Yes, I think so too. So one course so the antibiotic treats the infectious agent that we're trying to get rid of, say a strep throat, but it also kills off the good bacteria in someone's gut. So
you always picture if you're taking it for strep throat, you're swallowing it, but it's only going to your throat. And you're saying it's going through your whole body.
Yes.
And it's killing off the good guys as well as that strep that's made you sick.
Yes, absolutely.
And then how do you replenish?
How do you replenish? So typically we'll use good bacteria, so in the form of something called probiotics. And particularly if there really is a need for antibiotics, you would put someone on a higher dose of probiotics to ensure this imbalance didn't occur. So real important.
So people with gut imbalances might have a hard time absorbing their nutrients.
Absolutely.
Do they have other symptoms if they have a gut imbalance? Like, how would you know if your gut's out of balance?
A lot of those patients come in complaining of that they get bloating after they eat, or maybe they have diarrhea and they can't figure it out. So those are the two common ones. And then if you're not absorbing, it's all the symptoms that come by being low in your B vitamins. So for some people, that's a lack of energy. They feel fatigued. For other people,
this is so endemic.
Yeah.
I mean, it's sort of like poll 10 people and they're all fatigued.
Yeah, exactly. And it's usually a combination of everything we've just talked about, why they're fatigued. So.
Any other ones, like zinc? I mean, you see the things, calcium, zinc, magnesium.
Yeah. So zinc is real important because zinc is necessary for when something in your body makes thyroid hormone, and thyroid hormone keeps us lively and energetic. So everyone coming in fatigue thinks they have a low thyroid, and that might be, but usually more often than not, it's that they don't have enough zinc to aid their body in making that thyroid hormone active. So
the thyroid's working and they're making inactive, but they don't have enough essentially supporting cast members to make the inactive into the active?
That's correct. And zinc is just one. So it's zinc and selenium and iodine. It's probably and iron even. So
very cool. And no, we're not saying go take these things. We're saying come get tested. right?
That's exactly right. Yeah, you wouldn't want to replace anything you didn't need, and you would know if you're eating a sound diet based on some of the testing. And you can even identify within the nails zinc spots. So they're the little white spots within the nails may suggest that you're zinc deficient.
Any other sign? I mean, I've heard acne.
Acne's one, and even eczema. So those are so any of the skin rashes that present may be a zinc deficiency as well.
Interesting. Yeah. All right. What about magnesium?
So magnesium, the way people don't even know, but then I'll ask them, I'll say, do you exercise? And most of my patients exercise to some degree. I'll say, do you get muscle cramps? And they'll say, yes, absolutely, I get muscle cramps. And we test their magnesium levels and they're quite low. And once you replace them, that cramping goes away. Or the other thing we'll see is I have a nice regimen for my headache sufferers, and one of the things I like to replace even before knowing levels is magnesium. It tends to be preventative. That means it prevents the headaches. And sure enough, they're low in their magnesium, and they almost always come back in after doing my little regimen that I use preventatively, and they say, my headaches are better. And I said, great, and you needed it too, but look at your blood work.
So far, you've told me that pretty much everyone we live in the Northeast, so everyone's vitamin D deficient.
Yeah.
Anyone who exercises needs to look at magnesium and zinc for if you're feeling fatigued.
Yeah.
So cool.
Yeah. And then B vitamins in your vegetarians or anyone who's fatigued. Yeah.
And then if your gut's out of balance and you're not, so if in any way you react in a non-positive way after eating.
Yeah, exactly. So indigestion, bloating, diarrhea. So those.
Any constipation, does that ever?
It can as well. So I see them both.
So anything.
Anything, really. Yeah.
Okay. And what about sleep?
Sleep, that's a big one. So I love when patients come in and they say, but I've always only slept 5 hours a night. So it's cumulative. And unfortunately, as children from infants through childhood age, you can make up for lost sleep. But after a period of time, as an adult particularly, you can't make up for that lost sleep. So 7 to 8 hours is a good all-around goal to shoot for. And then getting to bed between 9 and 10 to be asleep by 11. That's where you're...
What's so important about sleep? What do you do while you sleep that matters so much?
You regenerate your cells, and you know.
So anti-aging.
It's anti-aging. So I mean, instead of going for your face peel or your Botox, sleep should be high up on the list.
So 15 minutes a day of rest, of meditative, or it does. You know, it's funny because I'll say to my patients, "Go meditate." They say, "I don't know how." So I say, "Just breathe in and out. You know how to do that, right?" I always laugh. So breathing, otherwise known as meditation. More sleep, aiming for 7 to 8 hours per night. Having your nutrient levels checked. Okay. What about, I don't think we've talked about the structure in terms of moving one's body and that type of thing. Can you say anything about that?
Yeah, you know, it depends. I always assess where a patient's at, and you know, there's all different kinds of guidelines. So we know that if you're preventing heart disease, it's 30 minutes a day, 5 days a week of aerobic exercise, so getting your heart rate up. And there's calculations we can do to help patients identify where their heart rate needs to be with activity. And then over 40, we lose muscle mass, so it's really important to add some weight training then, and so you don't lose muscle mass. If you lose muscle mass, then your ability to metabolize food drops, so that people who complain about weight gain or and then just generally feeling overall energetic. And I will identify, I always say, you have to make it fit your life. So it's got to be something you like. Definitely shoot for 30 minutes. But they've even, you know, the New York Times had a piece on just 7 minutes. Yes, 7 minutes a day. I love it. So I always say start. So what if it's 7 minutes? Maybe your goal is you're going to start with 25 push-ups and sit-ups a day, every day. And then you're going to add, but it's got to be something you like, and it's got to be sustainable. So I want them thinking about, I'm going to make this change, and I'm going to stick to it the rest of my life.
So you have to move your body.
Move your body.
You have to get your chemistry in order.
Yeah.
You've talked about purpose in life. You've talked about balancing out the energetic. What role does emotions play?
Well, you know, they talk about I don't know if you've ever heard of the broken heart syndrome. So people who are, you know, married and one spouse dies and the other one dies shortly after. Yeah. So, it's real important to be connected to someone, you know, whether it's a partner or a spouse or your family, whether it's children or extended family. So yeah, and just the positive, you know, I think it's all too often easy to look at glass half empty, you know, instead of half full.
Right.
So, and that drives all the other, we talked about a little bit about the stress, it drives the hormone levels in the body and leads to just the adverse effects on your health.
Can what I'll call toxic relationships, increase your stress hormones?
Absolutely, because it's negative energy and then it's that perceived. So say that there's someone you spend a great amount of time with, or maybe it's a neighbor that you have to kind of associate with, or maybe it's a family member, again, you have to associate with. And they're negative, 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 whether it's things they impose on you or just their attitude. And if you're not able to come out of that, I mean, it does, like attracts like, so you have to be, all the things we talked about before about raising, so it leads to a different type of stressor.
So the thoughts you have and the emotions you have can impact you chemically, it sounds like.
Yes, absolutely.
And then to break that, you're recommending people meditate.
Meditate, yeah.
All right, so let me ask you that. I could imagine sitting at home watching this and saying, we have all these cool medicines and we have all this cool technology, and you're saying it comes down to what you eat and how you breathe. It really, and how you move your body.
And how you move your body, yeah.
So eating, breathing, and moving.
And who you affiliate with, or what, you know, kind of the emotional piece. So, yeah.
It's pretty simple.
It is.
So why is it so hard for us to do?
That's a good question.
I promised I wouldn't ask any hard questions, and then I just asked the humdinger.
That's $1 million question, and I think we'd be out of business if we, if it were so easy. Yeah.
So so you essentially ascertain if someone's a cold turkey, a jump right in person, or if they're a make small incremental changes person?
Yeah, I try, because the more I can assess that, more readily assess that, then I can give them the tools they need to make the changes.
Okay.
So I know how quickly I can move them through. And I've gotten it wrong, but then we get it right. I've had patients come back.
We should have that on our questionnaire.
Yeah, we should. What kind of person are you? Cold turkey kind of person?
Yeah.
Or slow to change?
So as we're coming towards the end of our show, I'm sure I've missed a million questions to ask you, but is there anything major?
Really just that, you know, I love that we can provide our patients with an extended consultation time to really get to know them. That's where I think I've made the biggest difference in working in this type of field of functional medicine and the environment that we've established. So that's the biggest difference, is really finding out where those imbalances are by having the time, simply having the time.
You love what you do.
I love what I do.
Thank you for coming on the show today.
Thank you, Wendy. It was an honor.
It's my pleasure to have had this conversation with Dr. Rajka Milanovic. She is a family medicine physician at Visions Healthcare. I'm Dr. Wendie Trubow, and you watched another episode of Visions for Health.